His jaw had been rebuilt, but bringing this patient back to a normal life would take one more complex surgery.
He has a working mandible with no cosmetic deformity, but he has no chewing ability on the left side. There is a large step between his mandible and the fibula is also buried in almost 2 centimeters of soft tissue. The only way this patient is going to get fixed permanent teeth in this area is with dental implants. I decided to perform another virtual surgery to treatment plan this case. Thankfully, there's enough bone to place one implant distal to the last tooth in his natural mandible. The rest of the implants will need to be placed in the fibula. The challenge here is that the fibula has a limited amount of bone volume. It's very deep, and there are screws that run throughout it holding it to the reconstruction plate, which I have to avoid. The virtual surgery is extremely helpful as a map to where I'm going to place these implants, but it's limited. The problem is, there's no way they can make a guide that's going to help me during the surgery, so this is all going to have to be done freehand. This next procedure is performed in the office under IV sedation. I laid a full thickness flap and dissected down to the fibula and then placed these implants under copious irrigation. Here's the post-op radiograph, and I'm thrilled with where these implants are at. Now comes the next challenging part. These implants are buried in almost 2 centimeters of soft tissue, so normal healing abutments aren't going to do us any good. I ended up using chimneys to expose the implants so that the prosthodontist had access to them. So you can see this patient's come a long way. He initially presented when he's 16 with a large mass in his left mandible, and here we are over 2 years later, and he has a fully functioning mandible with teeth. This patient started care as a teenager, and he's now a full-grown adult, and he's doing great.